When looking for a therapist, whether it be for yourself or someone else, the typical things that you might look for initially would be proximity, their hours of availability, and if it fits your schedule, and if they fit your budget. But when you're looking for a specific concern that you want to address, especially if it's trauma related, you may want to look for additional expertise in specifically treating trauma. And so first and foremost, you'll want to check to be sure that the therapist has a license in the state of which they are practicing by a state regulatory board. You want to be sure that they are credentialed by the state to provide counseling. And then you'll want to see if they have extra expertise in evidence-based treatment. When a therapist graduates from their master's degree, they can then pursue additional training and education on specific topics. And so for a therapist who treats trauma, you'll want to be sure that they are trained in an evidence-based treatment for PTSD and trauma. Evidence-based just means that it's a method of therapy or a model of therapy that has been proven through research studies to successfully treat trauma and to reduce the symptoms associated with PTSD and trauma-related disorders and challenges. And so some specific things might include EMDR. That is a specific modality and therapy that we offer at our practice, as well as trauma-focused CBT, child-parent psychotherapy, attachment regulation and competency, or ARC, and the risking connection framework. All of these are evidence-based therapies that have been proven to be effective in treating trauma. Some modalities are specific to adults and some are specific to children. Some apply to pretty much people of any age. More important than their training and expertise are some other things to look for once you start counseling. The biggest predictor of successful outcomes in counseling is whether or not you as the client, or if you have a child that you're seeking trauma therapy for, that your child feel first and foremost safe, that you feel safe in the therapy room, and that you trust your therapist. If you don't have safety and trust your therapist as they guide you through really challenging counseling, the effectiveness of therapy for trauma is not going to be great. So first and foremost, you need to feel safe and trust your therapist. Your therapist should also empower you and should allow you to make some decisions about the therapy. Usually evidence-based treatments for trauma are, they happen in phases. And so there's a whole emphasis at the beginning of therapy on helping the client to feel safe, equipping them with resources and maybe some coping skills to help them manage some of the symptoms and prepare them for the hard work of trauma treatment. And so a therapist who specializes in trauma should not only make you feel safe and trust them, but should also give you a lot of collaboration and control and to empower you in that process as well. And so as you're choosing a trauma therapist, I want to encourage you to look for these criteria. I know that it's really hard, and taking that first step to reach out for help is the hardest, but there is hope, and these methods have been proven to be effective. Best of luck. Let us know how we can help you.